helping people with leg pain and swelling for over 20 years. Today we're joined by Dr. Charles Moak, the founder of Allure Medical, to tell us more about how they are serving patients. Dr. Moak, good to see you. Thank you so much for being here.
Thanks for having me.
Yeah, you got to watch us on those trampolines, and of course a lot of people may not be able to do things like that because they've had pain in their legs, swelling, and different things like that. First of all, let's talk a little bit about how Allure Medical and how you guys started and really helping patients for 2 decades now.
Yeah, so the traditional issue with leg problems is circulation or bones. And we're treating mostly with circulation, venous circulation. And it might manifest as varicose veins, but it's commonly just swelling and discomfort and aching. And 20, 30 years ago, over 20 years ago, there wasn't many options for this, maybe wearing compression stockings or some kind of garments. And now we can use an ultrasound and find out which veins are not working and redirect the blood to the veins that are working and healthy. Non-surgical procedure, pretty quick, it's an outpatient. We do a diagnosis with ultrasound that tells us, creates some roadmap, tells us exactly what's going on, and then we reroute the blood. And things like swelling will get better fast, discomfort fast, and then you can get back to normal activities. And you were doing the exercise and your balance, we talked about that during the break, is that's so important to stay active. And as we're getting older, we want to have our full capacity to be able to walk, get around, and move. And having what we call venous insufficiency is really like it inhibits that. You know, your leg's heavy, it aches, maybe you're not walking as much, maybe when you do stand a long time, your legs hurt and swell. So this is something that we really should not live with. We should get it diagnosed and fix it.
And like you said, technology has changed and evolved over time, where it used to be something that you had to have only surgical options, but now with the technology that you guys have, you can really make it, you know, pretty painless, which is...
Well, and you might even say at one time the cure was as bad as the disease.
Yeah.
Because there really wasn't much, it was maybe a surgical option, and now it's totally non-surgical. We use a device that basically destroys the vein that's not working, and the blood automatically reroutes to the healthy vessels. And it's really fast, there's no downtime at all, there's no getting put to sleep, you get it done, go right back to your normal activities.
I think that's fantastic. A lot of people just probably didn't think that it was something that was that easy. But for people sitting at home right now, they say, well, I have a little bit of pain. Are there some things that they should be watching out for? Is it like a visual thing that you see that you're like, maybe I should get it checked out? What are the warning signs?
That's a great question. In many cases, they might not see a visual problem other than their legs, maybe they can see, they take their stocking off, they see an imprint. They feel their legs are heavy. So you might not have any visible signs, but you might have bulging veins, and that would be a varicose vein. Varicose vein and venous insufficiency, they're interconnected, but you can have venous insufficiency without even seeing the veins bulging and have swelling and discomfort. So I would say, you know, a lot of times the family doctors maybe aren't really aware there's modern non-surgical options. So it's an opportunity for you to talk to your doctor about it, get referred to a vein clinic, check your circulation out with ultrasound, and then come up with a plan. Is
that the thing that we should call you guys to say, hey, I've been having these issues? Is it something that my doctor has to call you and kind of refer me to you? How does that work?
Yeah, great question. No, you can call us directly and we'll see you, and we'll send a note to your doctor about what we saw and what we're planning to do.
Awesome. And your website is alluremedical.com.
Yes.
They can go there and they can kind of reach out to you guys and tell you about their specific case and kind of get started with that treatment.
Yeah, we'd love to get right in and get in our office, and we'll do an evaluation, an ultrasound, and come up with a game plan, communicate with you and your doctor, and get your legs feeling better and moving faster.
Dr. Mock, thank you so much for coming and telling us about Allure. And we're going to have Dr. Mock on a couple times to talk about different things available to you as the Allure team can take care of you. We're going to take a short break. More YC coming up after this.